Hi, I'm Dr. Andrew Jordan, Rheumatologist at BJC Health in Sydney, Australia. One of the more common conditions that I get to see is lateral hip pain. Lateral hip pain goes by a few names that you may hear about: trochanteric pain syndrome, trochanteric bursitis, or people just say I've got bursitis in my hip. The underlying problem here is the tendons of the gluteus minimus, which runs like this, and the gluteus medius, which runs like this. These muscles are really important for stabilizing the middle of the body, so we call them pelvic stabilizers. And often you'll get the lateral hip pain after these muscles have been weak for many years usually. The tendons get under strain and they become painful. There may be a little bit of bursitis overlying it, but it's incorrect to think of this as a bursa problem. The best way to understand it is a tendon problem. Sometimes there may be chronic tears in the tendons, other times it may just be tendon inflammation. The most important thing I want you to understand is that this problem occurs because of long-standing weakness. The weakness happens in all of the pelvic stabilizers, so the abdominal muscles, the big gluteal muscles, and the smaller gluteal muscles on the side. And the most important thing for your long-term management is you actually get stronger in this region. Medications such as tablets have a small role to play. They often just take the edge off the pain. I will sometimes use a steroid injection, not as the only treatment option, but often to reduce your pain level quickly so that you can then see allied health professionals such as a physiotherapist or an exercise physiologist to get stronger. Without the appropriate strengthening, your pain's just going to keep becoming an issue. If you've done a lot of strengthening, if a steroid injection's not settling your pain and in you a lot of discomfort, I will sometimes use platelet-rich plasma injections, which is particularly helpful to treat the tendon tear there. This is an area where it's the body of evidence is growing, and it's a little bit controversial, but I find it very helpful in patients who are just really struggling with long-term pain. So my takeaway message here is lateral hip pain, think tendon problems, think weakness, and the only way you're going to help this is to get yourself stronger. I hope that helps you understand this problem and how I approach it. Please feel free to leave comments or questions below.